Your patient calls in complaining about a hole in their sleeve. Here's what you can do to help them get by until they can see you for a replacement. Hi, I'm Jeff, CPO with Ottobock, and this is O&P Workshop Insights. To begin, we need to locate the hole. Remove the sleeve from the socket and invert the sleeve. Now place one hand inside of the sleeve and begin probing by stretching the sleeve over your finger. Keep in mind that most holes happen around trim lines. You can use the light as a guide to find those small holes. There it is. Now that we know where the hole is, we can place it back onto the socket. Next, you can take an old sleeve or an old liner and a sharp pair of scissors, cut a section out, and round over the corners. Now you can invert the sleeve, find where the hole was, and place the patch with the gel side against the gel, and then roll the sleeve back up, therefore sealing the patch against the hole. That should seal that hole up and get your patient by until they can return to your clinic for a replacement. That's it. Let us know what you think in the comments, and be sure to check out our other videos at Ottobock Professionals.